meeting.
All right, this is a special opioid crisis committee. This is Thursday, January 26, 2017. We're at 6 p.m. I have Councilor McKinnon.
Here.
I have Councilor DeFlorio. I have Councilor McLaughlin. I have Councilor Capone.
Here.
We have 4 members present. We do have a quorum.
Please stand to salute the flag.
Pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Since this is our first meeting of this year, we have new members on the committee. I want to introduce them. Rosa DeFlorio, Fred Capone, and a returning member, Mike McLaughlin, and myself. Let me see here. We have a few things that I'd like to update, but what I'm going to do first is we're going to have to try to get some of the invited guests out of the way, and I'll bring these up to speed as we go through the process here. If we could read the first piece of business.
First piece of business. This is to create a opioid response team.
Could we have the captain from fire come up and just state your name, please, sir? Thank you, sir, for appearing tonight. I'm going to ask a few questions, and I'm going to open it up to the floor to the rest of my colleagues. But the questions right now, I know that we were in talks early on the recovery coaches, and we've produced the $6,000 to send 10 out. I spoke to the chief. You were here at that meeting when I spoke to him.
Right.
They're going to be stationed, I believe, right at the fire station.
Yeah.
And
Will
it's
be
going to be called what? A safe house, safe station?
Safe station, right,
Okay.
safe haven.
All right. Do you have any information other than that, or?
No, we're actually still in formulation,
Mhm.
but the plan would be that would be their point of contact to the program would be at Central Firehouse.
Okay.
Hopefully that when the clinician comes on board, he or she would actually be stationed at Central Station with an office.
Sure. All right, so we'd probably be looking at station the clinician somewhere at that point down there.
Exactly
As
right.
well as, I'd like to see, in my opinion, I think the recovery should be at each fire station. So there's a couple of different points, but that'll be logistically one over one. We get that
Exactly
chief
right.
in front of it. Okay.
And it also comes in, we also have to take into consideration training the house offices in each of those stations.
Sure. For these people to come in and actually.
Exactly.
Okay. All right. So that's on the move. That's a leftover piece that we were working on from last year, and it just rolled over to this year.
Exactly.
There's a few pieces that of the puzzle that we were also working on, the clinician as well as the program coordinator.
Right.
From what I'm understanding, and if we could have Kathleen Rollins come up, please, from the mayor's office.
Thank you.
Hi, if you could just state your name for the record, Catherine.
Yep, Catherine Rollins, Policy Director for Mayor DiMaria.
Thank you. I know that I spoke to Mr. Vetrano. He's the Human Resources Director. He is at another place right now, so he called and asked you to testify for him. Do you have any insight on the clinician position as well as the program director?
I do. I'll just read a very brief and concise statement to him that gets right to the heart of it. On behalf of Mayor DiMaria, I am pleased to report that we have identified the final candidates for both the program coordinator and clinician positions. These candidates will be meeting with the mayor next week, and offers of employment will go out to the candidates selected. If all goes smoothly, we should be looking at a start date of February 6, 2017 or sooner.
So start date would be February 6th. Okay. Now, with that being said, that is another rollover from last year and the meetings of last year, so now those will be put into play February 6th, correct?
Yes.
Okay. So once they're put into play, logistically, we'll have to go over with the chief where they're going to be at. I believe the program coordinator was scheduled to be here in-house with health department?
Yes,
Okay.
that's
And then the
correct.
clinician should be out in the field?
Primarily, yes.
Okay. And then also the recovery coaches, we're going to start trying to look at those as well. And I believe the clinician and program director will be part of that, as well as Ms. Scalise from Everett Overcoming Addiction.
That's correct.
All right. Now, that's all rollover from last year. Any new items, I'll say they're new items for this year, so everyone will understand what's going on with that. Any questions from the colleagues so far? Councilman McLaughlin.
Catherine, thank you. Catherine, how many candidates did we have apply for either or both of the positions? Do you know offhand?
I don't know. I can have our Human Resources Director get you that information. But
I was
wasn't-
talking to Mr. Vachano as well as Councilman McKinnon. I just was curious because I knew that there was different numbers coming in.
I can actually
Do you know how
answer
many
that.
trickled down to the final? That's what I'm looking for.
There was 7 and 7.
For final?
No, 7 and 7. Total 7 for one position, 7 for the other position, and then they trickled it down.
Do you know how many it trickled down to the final tally?
I don't know that,
Okay, yeah, I don't
but I
as
know
well
there
then.
was 7 total on
Right,
one, and then
that-
7 total on the other. That's what I was told.
Perfect. I had heard the same, and I was just wondering what it had been trickled down to as for a final.
I know
candidates.
right now, the final process took a little bit to
It did.
get to, but now it's finally here, so I'm kind of glad that we're actually going to see this.
You know, I agree wholeheartedly. I was just wondering how many of those 7 candidates moved on to the next stage, if you will. But I can talk to Mr. Vachano
I don't know
about
the
that.
mechanics of it, so I
No,
can't
no,
even
no problem
comment
at all.
on it.
Thanks, Mr. Chairman.
All right. Any other questions, council? All right. If we can have testimony from Captain O'Brien and also Catherine Rollins. Mr. O'Brien, you can go first.
Sure. So the one thing I wanted to speak to was our Department of
Just
Public Health grant.
move the mic over.
Our Department of Public Health grant. The first year we got the grant, it was $10,000, both for fire and police. The second time we got the grant, it had whittled down to $6,000. What we used the grant for, the first grant where it was a little bit more money, we had built in some training. But primarily what it was used for was to buy Narcan and Loxolone for field use. I actually received our final invoice for what we've used so far this year, and that comes to $5,621. So we have somewhere in the neighborhood of $379 left for buying Narcan for the rest of the year. This has become a question of sustainability.
Sure.
We will approach DPH for more money to cover the expense.
What was the total amount before? $6,000?
$6,000, yeah.
And that was a grant?
Right,
Okay.
purely grant money. And with that money, we not only buy Narcan to keep on the fire apparatus, but it's also the same money used to keep Narcan in patrol cars and also at the,
So that's 6,000 for police and fire?
yeah.
And
Up
also
to
high
this-
schools?
Up to this point.
And
it's for police
schools
and fire.
as well?
Exactly right, schools also.
Okay. Ms. Rollins, is there any other grants out there besides just the DPH? Because I know some certain cities are out there, they're actually getting this from hospitals, surrounding hospitals, and they're getting it for free.
I haven't heard of anything available now through any hospitals in our region. I will just very briefly say that there is federal money that is scheduled to come down to the states. There was $1 billion allocated in an act that was passed by Congress and signed by the president, one of his last actions. That does allocate $1 billion over 2 years solely to go to states to work on opioid treatment.
Who wrote that legislation, do you know?
Oh gosh, I will get that for you.
Okay.
But it was it's considered the biggest healthcare legislation since the Affordable Care Act, and it contains several $billions to fund research for National Institute of Health on sort of long-term cures for many of our chronic diseases that many folks struggle with. It also changed some of the standards for how pharmaceuticals go to market. But the biggest part, I think, for particularly this subcommittee is the $1 billion, $500 million for each of the next 2 years, and we're told that it will be distributed to states based on need. So I think clearly in Massachusetts, sadly,
one of those
we've
states.
very much demonstrated that we have need. I was able to talk to the Department of Public Health today. They have been working very closely with the federal government, and they're submitting an application for some formulation on February 17th. So I'm hoping that they're including some more opportunities that we can directly access at the local level. Of course, as you and I discussed, Mr. Chairman, it's very much contingent on this money being released by the federal executive agencies. So I think we need to watch very closely as to what happens to make sure that this money actually does come out to the states.
Sure. So, and it's states as needed, correct?
Yes, those
Okay.
who demonstrate the most need are entitled, under the intent of the legislation, to get the most money.
All right. And I think Massachusetts is definitely on the map with that.
Yes.
Okay. Any other questions through the Councilman Capone, then Councilman DeFlorio?
Thank you, Mr. Chairman. Through you to the captain. The $6,000 grant, is that fiscal year or is that annual?
This fiscal year.
Fiscal year. So you said 6,000 combined for school, police, and fire?
We use the 6,000 to supply naloxone to those three agencies, yeah, those
Okay.
three departments.
And that 5,600 some odd, is that every one of those units, or is that just the fire department?
So the way it breaks down is about $4,700 is for the fire department, and the remainder is to keep the naloxone in the schools and whatever the police need.
Wow. And so you've actually used 5,600 and some odd.
Yeah.
So it leaves you 300 and something for the next,
Right,
5
till
months.
July.
Yeah.
Yeah.
Wow. Thank you. No other questions?
Councilwoman DeFlorio?
Thank you, Mr. Chairman. Captain, I don't know if you know the answer to this, but the Narcan, has it gone up in price compared to?
So we actually use two versions of it. One is a 2 milligram dose, and it's a multi-stage that you have to put together. The police and the school system uses that. That's $40 a dose. What we use is it's an already assembled 4 milligram dose, and there's 2 doses to a box, and a box costs $118.
So is that the same price that it was prior when you got the $6,000 budget? Is it more money now?
It's kind of interesting. The 2 milligram dose has gone up only like $3, and the 4 milligram dose has actually gone down in price. We have an agreement with Cambridge Health Alliance. That's what we buy. We buy it right from their pharmacy, and they actually probably give us the best price that they can get.
What is that? What is that price?
So $118 for the 4 milligram dose that the fire department uses, and $40 per dose for the 2 milligram, which the school department and police use.
Thank you. Councilwoman?
Okay, thank you.
So,
Any other, Councilman McLaughlin?
Thank you, Mr. Chairman. Mr. Chairman, maybe you can answer this question. At $118 per dosage for 4 milligram that the fire department uses, where do we go after $370, $9 is left? Where are we going to go? That's a major alarming fact that I've just learned tonight for the first time. Catherine, anybody can chime in on this? At $118, you got 3 boxes left at this point for the fire department.
this is what we have on the shelf right now.
Yep.
Right, I mean, I can assure you we'll certainly find it. We will not go without Narcan. We will absolutely find a way to fund this in one way or the other. And as we've discussed, we're very actively looking at any funding opportunities coming down, but we will certainly not let our first responders go without this.
And to touch upon that is, it's been used readily all along here. So, and I do believe that it's saving a number of lives out there. So,
Absolutely.
we're not gonna let that fall short.
Absolutely, Mr. Chairman.
We
Through you
can't.
to Captain O'Brien. Captain O'Brien, when we had the $10,000 the first year, did that get us through the first year of need?
Sure, it actually, we were using, at that point, we were still using the 2 milligram dose.
Okay.
It got us through the year, and we actually had, like I said, extra monies to do some training.
Okay, so at that point, the 4 milligram wasn't in play yet.
No.
That we're currently using. I'll be honest, I'm surprised to find this out tonight because I think we should have had an appropriation of at least bringing this back up to 10,000, which we had in the first year. Which,
Right. I think what
if
we
I had
really
known
want-
that previously, that would have been something that was addressed immediately.
Right. I think what we really wanted to, we thought that we'd be able to manage this. What we saw was an escalation in the overdoses, and we weren't keeping up with it, simply. That's
Yeah,
really
I
what
mean,
it boils down to.
To be truthful, right, it's 6 more months, and we've spent almost 5,000. I mean, we need to almost double the 6,000 of what we have in grant right now just to get through till July 1.
Based on current numbers,
Based on current
unless we
numbers.
fall behind again and it escalates.
Absolutely. I mean, even just to have enough to just be safe and not in,
Right.
not in the chasing aspect of this.
Agreed.
You know, last thing anybody wants in this building is to run out of Narcan in an
Right.
emergency situation. Nobody in this building wants
To
that to occur.
Catherine's point, though, I think that if we needed to, phone calls would be made and money would be found.
Yep.
I think everybody's moving in the same direction that way.
I'm going to talk to our CFO tomorrow morning to make sure that he puts an appropriation before us in the coming weeks to, I'm sure my colleagues feel the same way, to make sure that we have raised that cap in the next couple of weeks. Thank you.
Very good.
Council, that will go through the committee as well, so we would request it through the committee, correct? Okay. Yeah? We'll make a motion on that after. To the fire department, new coding system?
So we use a program called Fire Track. We keep track of all our numbers, all our calls that we go to. And what we were realizing in reporting to DPH, that we were missing the finer calls to delineate between an overdose and Narcan use. So we've actually extrapolated our codes so that we could identify specific responses to that. So we know every time we use Narcan, we know every time we respond to an overdose of or heroin or an overdose of some other drug.
Okay. I mean, we talked about this in the past, that's why I'm glad that it's actually coming to fruition.
Right.
And we got it up and running now. So we'll have accurate number?
Yes.
Okay. And is there any way that we can get a monthly report on that
Sure.
from you guys? Okay.
Yeah. Actually, our ambulance provider, our transport provider, Cataldo, and the fire department share numbers monthly
So-
so that we can get an accurate count of what's really happening.
Yeah, I'd like to see if we can get an accurate count
Sure.
on it. Just so that we have the numbers are jiving, because at one point we were number 1, then we went to number 15, then we
Yeah. came
back up, so.
Yeah, there's a lot of different
Yeah.
plays in those numbers.
Absolutely.
I think what skews it is that a lot of DPH's numbers come out of patients who are treated at Cambridge Health Alliance or Everett Hospital. And those are not necessarily patients that we see or that Cataldo sees.
I'd rather have your numbers than Cataldo's numbers in the city of Everett.
We can do that.
Okay. Thank you very much. Any other questions to these two guests? Any other information you'd like to share with the committee? Either one?
Sure.
Catherine?
If I may very briefly, I did want to share that last week, Mayor DiMaria was able to attend the United States Conference of Mayors winter meeting, which was held in Washington, D.C., and there was significant discussion of the opioid epidemic across the country. I think sadly, everyone's in agreement that it's getting worse and it's spreading. It's not just New England, it's not just the Midwest. There were folks talking about how it's now a major concern in the Southwest as well. So the keynote speaker for the Conference of Mayors meeting was the Surgeon General. He talked about a report, which we can link to on our website, called Facing Addiction in America, the Surgeon General's report on alcohol, drugs, and health. This is the first report like it of its kind by a Surgeon General. The closest thing to it previously had been a similar structured report on smoking, and that was 40 years ago. So a lot of the data is very disturbing and sad. It probably won't surprise any of us in this room. But there is a theme of reason to hope, particularly when you look at where we were with smoking 40 years ago everyone did it, it was causing major health concerns. Not much was known about necessarily the impact of smoking or how to stop smoking permanently. But now levels have decreased dramatically. Major health concerns and fatalities from smoking and associated diseases have gone down dramatically. And the Surgeon General sees the potential for the same thing to happen with addiction now that it is so broadly discussed across the country and it is impacting so many people. Again, I'll certainly make sure this is linked and I can get anyone who's interested a copy, but excellent data on everything from the economic cost of addiction. So, you know, I think most of us respond very much to the folks we know, the families here, everyone who's struggling with this and touched by this. There's data in here that makes the economic case. A dollar spent on an effective intervention can save you $54. I mean, overwhelming data on how important it is to take action. So some good ideas, some strong data, and a really sort of groundbreaking report from the federal level. And then just very briefly, another person who spoke at the conference was the First Lady of New York City, Charlene McRae.
Catherine, just make sure that mic is on, please. I want this all to be recorded. It's up? Okay, thank you.
I think it's,
on.
yep. So she was in there speaking about an initiative that Mayor Bill de Blasio of New York City has introduced very recently. It's called Thrive New York City, a roadmap for mental health for all. And one thing that was coming up was really the close relationship between mental health and addiction, and how too often still they're treated as very separate and distinct issues. She got involved because their teenage daughter disclosed that she was struggling with depression and addiction and some other issues, and the mayor of New York City had a very difficult time finding treatment for his daughter. So that led
It sounds like testimony we've heard here already.
Exactly, the same
Okay.
exact thing. And so he and his wife said, well, if we're the mayor and, you know, the First Lady of New York City, and we can't access what we need given all of the advantages that we have, imagine what your everyday New Yorker or your everyday
Absolutely.
resident is going through. So they have introduced this initiative, Roadmap for Mental Health for All, and it's actually 54 distinct initiatives that I won't go into now, but I'll be happy to share. Really just talking about the pervasiveness of mental health issues. 1 in 5 people at any given time are suffering from a mental health issue, and how at least 45% of folks who seek treatment for addiction also have a co-occurring mental health disorder. So closely linked. A lot of our treatment programs for addiction are not closely enough affiliated with mental health healthcare providers. So the city of New York took a very active role in really laying this out, trying to take the stigma away, and really stressing how interconnected mental health and substance disorders could be. So just really great content. I'm going to delve more into it in the coming weeks, and I hope to share it with everyone who's interested.
Could we, once you're finished with looking it over, could we have a report back from you on that, or just come to a committee and report back on it?
Yes.
How long would you think you'd need?
I'm going to say give me at least a few weeks, because
Sure.
with everything
So
happening.
the next monthly committee meeting we have?
Sure.
You'll be able to update us at that point?
Yes.
Thank you. So that maybe we could take some pointers off of that as well.
Sure.
That's a great thing, because we've had testimony here through physicians and also pediatricians that are actually saying they're connected. Mental health issue with the substance abuse issue as
Yes.
well. So that speaks volume. Thank you.
Thank you.
Any other questions? I'd like to actually excuse you. Thank you. Excuse with customary thanks, and look forward to hearing from both of you again next meeting. Okay, we have Joe and Sal. Right now, I see in the audience, we have Representative Joe McGonigal and also Senator Sal DiDomenico. Could we have them come before us, please? Gentlemen, if you could just state your names and titles, please, for the record.
Sal DiDomenico, State Senator.
Mr. Chairman, Joe McGonigal, State Representative. Good
Thank you
evening.
for appearing tonight. Gentlemen, what we're looking for is, we had put in for funding for positions to teach at an early grade level. And we've been hearing through the news and different other sources that some of that might have been cut through whatever source it may be. Could you report on that from the State House and give us an up-to-date funding scheme if you have one?
Naturally, Mr. Chairman, I'll let the Senator go first.
Absolutely. Mr. Senator.
So, the Representative and I were able to secure 2 earmarks for the city of Everett. One was directed toward the schools. One was directed toward the Cambridge Health Alliance.
How much were they for?
$75,000 apiece.
A piece?
Yes.
Something like that.
And we would secure those through the budget process, and we held them in conference committee. And then, unfortunately, the governor had some 9C cuts, which are mid-year cuts before they're appropriated. And he basically he cut all earmarks going to all communities across the state.
What was the total on that, do you know, Senator?
The total number of earmarks?
Yes.
92 million.
92 million.
So we're working with the House Ways and Means Chair and the Senate Ways and Means Chair and the 2 leaders of both branches to look at where we are financially the next couple of months, because fiscal year ends in June, so our budget will last until that time. And we have an opportunity if the revenue sources increase, and right now it looks pretty good, to be honest with you. So, but we have to get the guarantee from the 2 parties, and, the House and the Senate, to come together, and the governor's office, so we don't put a supplemental budget out and then have it vetoed again. So we have to come together, all 3 parties, and make sure that we are on the same page for all the things that we want to bring back. There's no guarantee, and it's a high probability, actually, that there will not be a full restoration of all of the earmarks.
Okay.
It'll be things that both branches and the governor agree on that serve the population that needs help the most, and this would be one of them.
Well, I agree, not to interject, but the, we've had testimony here, and I'm sure you're both aware of that testimony through pediatrics. They have come before us, and their testimony is some of them are seeing 8 out of 10 of the children that are born are actually admitted to the NIC unit, the neonatal. And you may want to bring this information back to them, because I know that I think it was Mark Gallagher from Senator Markey's office that had one of the pediatricians that testified here flown down to Washington to testify down there on that behalf. But it's at a cost of $200,000 per patient, depending on the amounts of weeks that they're there. It's $25,000 per week, and what it does is they're usually there from a period of, I'd say, 7 to 8, and then on, possibly 10, so at $25,000 per week. So that's the numbers that I had, and those are the numbers that went down to Senator Markey's office as well. So those, I believe, were part of the $600 million to $1 billion he was putting into play for a piece of legislation to get signed, Senator Markey. So I believe they were using some of those numbers from here to go down there. But those numbers are staggering. The insurance companies right now, to the tune of $200,000 per child, 8 children per month, those numbers are huge. So the savings would be to have early education early on, and we've discussed this many times. We're all in agreement with that. So if there's anything that you 2 gentlemen could do to help that scenario out, that would be greatly appreciated. Reason being is we've talked to the schools, the school department on this. I spoke to Mr. Obremski. They're all for early education. If we can get this, they may start it as early as grade level 4. So if we can start it at grade level 4, that basically helps this next generation coming up, so that we're not utilizing the Narcan. They already know what time it is, pretty much. So it's very important that we try to get that done, and that funding. That funding's key. It's a key piece to the puzzle here. We did the clinician, we got that through my colleagues' efforts, this committee's efforts, and the administration. We've also received a program coordinator. That position, same way, through the colleagues, through this committee here, the committee structure, the colleagues, and then the administration jumped right on board with it. We also receiving the 10 recovery coaches, but without that key ingredient of teaching at early grade levels, we're going to need that so that we can help this next generation coming forward. But sorry to interject. It was
No,
a little bit. It was a
that's
little
fine.
one.
No, you're absolutely right. So the state of Massachusetts has invested millions of dollars into this issue, and we know it's never enough. And this is the budget process for us, the budget season for us now. So we're going to be putting together, the House budget goes first, then the Senate comes in later, but the governor released his budget yesterday. And there's some good funding mechanisms in here for that, but it's basically level funded from last year. But the money is spent a little differently. We put a bill out last year, the Senate and the House put together a comprehensive package that the governor signed, and he supported, and it does a lot of good things, but we need more resources. And when you look at resources, where does that come from? It comes from the taxpayers.
It's money.
And where does the money come from, and how do we raise those additional funds to create the programs that we want to give to our communities and to our children? And it's all about, people willing to spend a little more to give more resources to this problem. And we're on the same page. We have all the people in the State House on the same page. We're trying to come up with creative ways to do this prescription, how to prescribe medicine. Having a healthcare workers get training
Sure.
on how they prescribe. And if you're a first-time opioid user, you get a 7-day supply instead of a month supply.
That's great.
Or partial
that.
fill, for your prescription. So we have all these things that now that are at the disposal of the healthcare providers, even to the point where you can actually say you do not want opiates. You want something else besides that because
Sure.
you don't think that's appropriate for you. I think I told the story to this committee last time I was here when a friend of ours at the State House, they were engaged to someone in recovery, and they broke their arm, and they were sent home with 100 pills to a home that has someone in recovery, and you're going home with 100 pills, which you don't even need for a broken arm. So we have to do a better job of our healthcare providers have to do a better job of going through these training sessions, learning why that's not appropriate. And we all know it's common sense, really. It's not even about training, just common sense on top of it. But we have to just do a better job of making sure that we have the resources, for training and for all the good things that we're doing right now and build off of that. And the Narcan, bulk purchasing for the Narcan, making it more affordable. I know it's not, Councilor McLaughlin was concerned about the cost. Just imagine what it would be if we couldn't purchase in bulk. And that's
Well,
that's part of the problem, but I don't want to take up
on
the
another,
representative
yeah,
time.
on another note with that as well as the Narcan, as I remember when I worked in the medical field, it used to be almost $1 a vial on an emergency crash cart. Since they couldn't make their money on the opioids and we're attacking them that way with the overprescribing, it seems like they wanted to try to middle it, and they raised the price of Narcan to like $40 now, which is sad.
Right.
So, I mean, I just think that's greed at its finest hour, and they're killing people. Big Pharma is killing people. So, and we've said it before here, and one of your colleagues, your esteemed colleagues, Mr. Tolman from Malden over there, said it the best when he testified before this committee. He said, Big Pharma is killing people, and he's not afraid of saying it. So, I mean, I think that the Narcan situation, from going from $1 something to $40 is horrendous, number one, and we need to look at that as well. But I think that this, right now, our message to you would be, and to the representative would be, that we want to see some type of funding for early education like that. Because I know that it's worked in LA and also in New York. And it could start here as well. And once it does start here, we could actually possibly save another, maybe a generation And that's the key. And everybody's on board with that. I get it. But we just need more your voice, which it's a good voice. You're on Ways and Means. You know, the vice chair of Ways and Means. And Joe, representative, the speaker's very much on board, because I met with him on another item that we're trying to do as well. You know, what's your take on this?
Well, nobody gets it better than the Speaker and the Senate President on earmarks. Those are what each one of the representatives and senators know what's important to their district. I don't pick that earmark.
Oh, yeah.
City Council picks it, and I'm just saying to you, so that was important that we had that opiate addiction educator. That got cut. We believe it's going to be restored. To what
That would be the best case
to,
scenario.
to what extent, I don't know. And we just were in caucus talking about the 9C cuts, where they're going to come out. And we are, like the senator said, we're waiting on the revenue to come in. But those earmarks are very important to every senator and state representative.
Well, it directly impacts the communities here.
Yeah.
That's why.
You know,
And
the governor cut 1.3 million out of that 93 million directed to cities and towns for opiate addiction issues. And again, I got to be careful how I speak here, because I'm upset with the governor when he gets up in front of us and says all these things on the grand staircase, 4 people and dying a day, and we're going to help you out, and he didn't. He didn't. So we're fighting hard to restore, especially that $1.3 million that affects the programs that the senator and I are fighting for. This opiate addiction budget started out a few years ago, I want to say 4 or 5 years ago, Senator, at about 84 million. Today it's 138 million. We understand, in my short time in the House, I see that they understand the issues that we're facing, because it takes money. That's what it's going to take to help us get through this. You know, Everett's issue is beyond anybody's in the Commonwealth of Massachusetts per capita. So the senator and I, the other day, at a meeting for a program that I want to talk to you about, Mr. Chairman. It's funny how you said early education.
yes.
And I have an appointment with Mr. Obremski tomorrow on a program, Calmer Choice. There's a program out and I have pamphlets here that I can leave this committee, and anybody that wants to take a look at it. I see we have Everett Overcoming Addiction.
Could you furnish the clerk with those,
Yeah,
please?
I will.
Thank you.
I'll leave them here. And what we learned, the senator and I, that this program from the Cape has been very successful going in to these schools in the 3rd and 4th grade and looking at behavioral issues and trying to combat them before they become another issue. And these are studies by Harvard and MIT that their data shows that when these specialists go in to these schools and deal and counsel these young children at that young of an age, which I'm shocked at. This is new to me, Mr. Chairman. I'm shocked at that it does benefit them, because the Cape and the Vineyards, again, have an issue.
A serious issue.
yeah.
Cape is
Correct.
really thriving with this right
Correct.
now, too, as
So-
well.
So I did bring these for us to look at, and like I said, we do have a meeting. I don't know if the senator can make it tomorrow. I don't know whether you're there, but with Mr. Obremski, for him to look at one of these programs.
That's great.
Okay?
My question on that note would be
Yeah.
that, would they be incorporating some type of opioid?
That's
Type
what it,
talking.
that's what it is.
Okay, all right,
It's a
so it's-
behavioral issue to counsel that.
So it's a mental health type of counseling
Abs-
plus?
Yeah, yeah, when
Okay,
you read
that's
it,
great.
it's quite a program that's been very successful. I'm just shocked that we have to reach these children at such a young age. I really am, Mr. Chairman, because I didn't realize it until you start listening to it and learning about it. You know, I think the problem's in high school, this and that, and it's not. It's way before
It's
that.
before that.
And you're talking about, you know, education, you know. This is one of the programs in the Commonwealth of Massachusetts that's working, so Mr. Obremski's interested and he'd like to take a look at it.
Well, there's issues, there's other issues as well, Mr. Representative, on that front. The reason being is because some of these children, although they may not have been born into a NIC unit and
Yep.
recovering off of any
Sure.
type of
That's
substance.
another whole issue, Mr. Chairman.
It's huge.
Yep.
8 out of 10, we've heard it here. But out of that, you're having children that are being brought up by heroin users, opioid users, drug users, and basically it affects them in a way
And that's
that-
what the senator and I learned at this program. That's what they're looking at. That's part of that behavioral issue of these children, which we're trying at the state level, Mr.
Yeah.
Chairman.
I mean, we're focusing in on some key issues, and these are the issues that are, you know, a lot of people are talking about out there that are actually living this now. So I think it's very important, these are very important messages that we're giving to bring back to the State House, and we're asking.
So the Senate has an initiative coming up with the House, and I'm leading it in the Senate called Kids First initiative. So we are looking at trying to be proactive in making sure that all of our children have the needs that they deserve and they require, and one being mental health, one being public health, and giving them education on drug abuse and substance abuse as well. This is a comprehensive study from 0, so the day they were born, through 5th grade. And in that report, we have set aside a section dedicated to this piece. Because when you grow up in a home or live in a shelter or experience trauma as a child, no matter how old you are, from 2, 3, 4, 5 on, how can we expect our children to go to school and learn when they're living in an environment like that and not understanding what a normal household looks like? They're being bussed in from a shelter, seeing the most horrific things that they could experience at a very young age, and then we tell them, go to school and learn. And we are doing a better job of trying to identify these children at that early age for the trauma and all what they experience, so they don't get into that cycle. Because
Sure.
that's what they see, that's what they know, that's unfortunately how they're growing up, and they come to school as a safe haven, really, from what they experience back at home. And that's what
That's a
we're
great
looking
thing.
at right now, and the report will be coming out in the next couple of months. It's taken a whole year actually to put this together, and it's focused on nutrition. It's focused on a whole host of things, but substance abuse is a big piece of this, and what they see and what they experience to break them out of that cycle. And we also talk about how to identify our kids in our schools right now. Even teenagers are in high school, middle school. Part of this bill that we put out last year allows, as a condition of this bill, that the schools have to conduct annual, verbal, age-appropriate screenings to all of the students. So if you're talking to the high school student or the middle school student, the guidance counselors, they are trained now to pick up signs and ask the right questions to try to identify these kids who need help. And sometimes there are kids among us that we don't even know have a problem.
Sure.
And they don't even know where to reach out for help, never mind try to find the right person to talk to. And we've had great success across the Commonwealth where these counselors speaking to these kids, for the first time somebody is asking them the question. And that's sometimes all it takes, is just reaching out to them and saying, what do we do, how can we be helpful? And then they open up. And then they get the services they need to help them. So there is all kinds of screenings going on in our schools right now, even for head injuries, people are being trained.
Sure.
For concussions in the high school level, to not prescribe them certain medication, so then they get hooked on these drugs. So it's a big effort by a lot of people, and as Representative McGonigal said, we keep putting more money into this. every year, and it's never enough because there are so many different avenues that you can attack it from. Education, treatment, there's so many different things, and you can't, we always thought about treatment was the way to go. Treatment was how we attacked this problem from the beginning. Now we're talking about education.
Early education.
Right. So
Very.
the treatment hopefully at some point will go down and education goes up. We haven't reached that level yet. We're still treating high and educating high. So we're trying to do the best that we can, and it's a big problem. Everyone in the State House knows it. Our leaders know it. We talk about this all the time in our caucuses, in meetings, and all kinds of lobby days we have at the State House. We're fully aware this is a big, big problem, and we are doing our best to try to put the money in the right places because the limited resources that we have, even though it goes up, the demand is higher and the need is higher.
Absolutely. No, I agree. I think we're touching on something that's very valuable here because I believe early education with these children, they need it. Reason being is because some of these children are either born into it or they're seeing it. And when they do see it, it's pretty bad. When you got children going to school and trying to figure out, if mommy is going to be alive today or daddy is going to be alive today, and they're just accepting it now, that's horrific. That is a horrific thing. I mean, imagine you have children, I have children, we all have children, and imagine them going to school and wondering if you're going to be alive today. It's pretty horrible. That's sad, I think. So what we need to do.
A lot of pressure on that child, Mr. Chairman.
Oh, it's tons.
A lot of pressure on those children.
So, I mean, these are the messages that we need to address, and these are the issues that we need to look forward to addressing. And I get it. There's been cuts, and I get the simple fact that we're going to try to get some of that funding back, and whatever that funding may be.
That's this year, Mr. Chairman, on the 9C cuts. But again, everybody has access to the new legislation being filed, and look at what we're trying to do.
Absolutely.
Once again, to create funding.
For that.
There's a bill in the House, 1881, that's being used at the forfeiture of any drug assets, and there's I don't know the bill, Senator, in the House that's filed with it, but that's to be used. A large portion of that is to be used against opiate addiction, and those are things that, because the senator said it, I say it, it's money. We understand it takes money for these programs.
It's going to take a lot of money.
We're trying, Mr. Chairman.
No, I understand. And we get it at the city level.
Okay.
Reason being is because what we're trying to do is we're trying to get the puzzle pieces together to make it acceptable for us to actually say, we tried to accomplish this year, we're trying to accomplish this next year, we're going to try to do this the year after that until this deadly disease goes away. And when we can start helping like children early onset, that's a great feeling. To save a generation, you know what I'm saying? That's a great feeling, I think. So if
I'll
we
leave
could
these,
do
Mr. Chairman, with the clerk or with Councilor
Thank you.
McLaughlin. I hope there's enough to pass out to anybody for
Thank
that program for early.
Absolutely. The more programs, the better. The more we talk about this, the better. We take off the stigma. I think we accomplished that pretty much last year because I think everybody's talking about it now. This committee in particular, I know that, and I know that you up at the State House have been. I met with Mr. DeLeo himself on a separate issue that we're trying to implement. We met with the senator on the same issue. I met with yourself, so we're all working in the same direction. If we can just get the help that we're going to need financially, I think we can accomplish a lot. So I thank you for appearing, but I'm going to open up the floor to my colleagues. Councilwoman Rosa DeFlorio, thank you.
Thank you for being here.
Thank you, Councilor.
Either one, whoever can answer the question, doesn't matter. There's a lot of places where they have Suboxone with facilities where the users can go to get help Do you know how many facilities we have in Massachusetts? I'm asking that question because I work in Boston now, and I know there's one not too far from us. And I'm not understanding how that program works, and I really want to understand it because I don't think it's helping, to be honest with you, but I could be wrong. I mean, I see people on the train, it's sad. I come home many nights crying. I see young kids on the train just coming out of these places that they're on the ground. So who's controlling these places? Is that state funded?
There's somebody, I believe, going to them, but I'm not, Counselor, I'm not the expert on where they come. I know you have some real experts in this audience that are out there on the street at night fighting this. I'm not, so I don't have that answer, but I see what you see. The
Well, the
Senate,
point
we
I'm
see it
trying to
all
say-
over Boston. We see it every
Councilwoman
we go.
and Rep,
Yep.
one second, I'm gonna bring up Patty Ann Scalise.
Well, the point, I
Please
want to
come-
make a point, please.
Yep, that's fine.
Okay.
Hold on one second, let me just
The
have
point I'm
her
trying to
up.
say is, if these programs are state-funded, I want to know how many we have, how much it's costing the state. The point I'm trying to say is if they're not working, maybe we can take that money and put it to better use, is what I'm trying to get to.
On that,
Okay, so that was
I
my
want the
question.
explanation for the Suboxone. Could you give that, Ms. Scalise?
That's medically assisted, that's what treatment, and it works, it does, if it's run properly, and they're supposed to be monitored and drug testing, counseling, and it's a good program if it's running correctly, but they're not really that monitored. And now, I know Cambridge Health Alliance and a couple other places, only certain doctors could give that out, and now they're starting to extend that, which I have a problem with, because if you're just giving out prescriptions and not following a protocol, you're gonna flood the streets with Suboxone, and in turn, the user's gonna sell it to buy heroin, and to withdraw from Suboxone, from my understanding, is it's worse than withdrawing from heroin. But I'm not knocking medically assisted treatment. If you work a program, that's great, at least, but a lot of them are selling them on the street. It's a vicious cycle. You can, for $10, you can buy a Suboxone.
But I thought they had to go to a facility to get this Suboxone, they give it to
The
them right then and there.
methadone is a daily dose, and you go there every day for that.
Okay, the methadone-
Suboxone is a prescription.
Okay, I'm sorry, so I got it mixed
Yeah.
up. So the methadone, are those run by the state? That's what I'm,
Yes.
okay.
Yes.
So what I'm sorry, I
They're
confused
not
it.
all run by the state, though.
Okay. Whoever runs, they have to get licenses to run.
Yes.
Okay. Is there money put aside in the state for these clinics?
Yes.
Does the state, do we, as the state, because we the taxpayers, do we fund these? Okay, so what
In
I'm
part,
saying.
in part.
In part?
Yeah.
Okay, so the point I'm trying to say is, from what I see, they need more control, okay? And I mean, this is what I see from the outside. I'm not on the inside, so I don't want to jump to a conclusion. But to me, I think the state needs to look at that very carefully.
Yeah.
Okay, because if they're spending money there that's not needed, then we could use that money somewhere else. And this is something that I want to be researched. I don't want to just jump to a conclusion and say, go shut them down or don't give them any money,
Yeah.
because I don't know that. So we do need to research a little
So
further.
the problem isn't closing them down and using the money. The problem is putting more money into monitoring these facilities. Because we don't want to close them down, because they actually do work. So the point we have to leave here saying is not shut them down. We need more funds to make sure they run correctly. And that's what the problem is right now. Again, limited amount of funds. There's a whole spectrum of how you treat different addictions. Education, and then treatment, and having certain beds, and there's a whole big, way of doing this. And they're much more educated about this than the two of us are, frankly. But when you look at the programs we have, there are some good programs and some not so good programs. There's definitely room for improvement. Nothing is perfect. If they were, there wouldn't be a problem. And if we had everything that we needed, then we could attack it especially hard and really, do some good work and do more what they do on the street. And she says Facebook every day and all these different things that are happening, we know what they're doing. They need our help. They need our help, and the experts need our help. So we have to do a better job of monitoring these facilities. I know people who work in them, and I know people who actually go there. And I hear that the people that are going, how good it is, and I hear the people that are working them saying, we have some good days and some bad days. And it's a mixed bag. But the solution is not to close them. The solution is to make them better.
To make them better. Yeah, no, I don't mean close them. They need to be monitored. If they're doing something wrong, then it needs to be corrected. That's.
Representative?
And Counselor, on these clinics, and I don't want to mention their names, because I renovate for them, and that's full disclosure that I have to give at the state level, because I'm involved in building them. Okay, when they come in and want to have 4,000, 5,000 square feet, and I've been doing it for roughly a little more than 10 years. At first, when I was involved getting one of these clinics up and open, it was just a window where they would show up and get their medication and leave. It's evolving every year so that the ones we do today have counseling and they have job placements and education, like the senator keeps talking about. So it's evolving, because I don't think we ever understood
Or expected.
or expected how big of a problem this became. So I see it, and we're trying to create more bed units, and there are good companies out there that I believe that are trying to do it correctly. But once again, at our end, at the state level, it's funding for these programs, and not only us. We got to go to our congressmen, we got to go to our senators and say, listen, we need federal money too, not only state. And I know there's grants out there, and these clinics, they fight for all this. So we're trying, but money is the big issue on
That's
our
the
end.
issue.
And the other part of it, too, is nobody wants these in their communities.
No.
So everybody says they want to be helpful, and they want to do the right thing, and they want to, help people, and then when they try to cite one of these in a community, then you see a groundswell of support on the other side saying, hold on,
The
we
pushback.
agree,
Yeah.
we love this program, just not in my backyard. So, that's an issue too, because when you're trying to go into the communities where you need it the most, sometimes you get pushback because people don't want those facilities in their communities. So it's a tough thing to balance all that.
It's a struggle.
In regards to the methadone, and maybe, Patty, you can answer this question. When someone is on the methadone, do they go in and they administer it right there, or do they give them a prescription to go out? I'm not
No, they
familiar with it, so I'm asking.
They administer it right there.
Okay.
It's a drink.
It's a drink. So
Yeah.
when they administer this drink,
Yeah.
why don't they keep them there for half hour, an hour, instead of letting them fall in all
Because
over? There's too much.
a line.
they're not falling all over the place. If they're working their program, they can function like me and you. And I'm no expert, this is from experience in my world. If they're working their program, they're not falling all over the place.
That's right.
They're just not. If you're taking your methadone and then you're cocktailing it with a benzo or whatever drug of choice you have.
That's when they're falling
And
out.
once you stop mixing all them, that's when you're
That's when they
seeing them
start- okay.
fall out.
Okay. That's why I said it.
And
wasn't
that's
educated
someone
enough
that's
and-
not working their program. They're trying, don't
right.
get me wrong.
That's right.
But this is where the monitoring has to come in. You have to do urine screening. You have to do the counseling. And you have to try to live the life of recovery. Go to meetings. Get a sponsor.
Mr. Representative?
Yeah, and I want to say this, Counselor, that's the stereotype of these clinics, that they're going there, they're getting their medication, whether it's methadone or whatever, and they're out on the street. They're trying to become, and I've witnessed it, productive citizens of society again. They really are. And they're not who you think they are.
And that's where
They're driving nice cars. They're working among us. They're working among us. And again, Ms. Scalise said it's counseling, it's moderating them after you get them, finally you get them into these programs. Because I see it as the end result and I'm shocked when I first got into being involved in building these facilities, what I witnessed, and it is every city and town, and the senator couldn't have been more on it, where when you try to go in to some of these even affluent towns where it's needed, again, this has affected not just our gateway cities, our urban cities, this has affected these.
Everyone.
This has affected the whole world. It's not
And
just.
they
it's
don't
not just
want them
here,
there.
just so
You know what I
everybody
mean?
knows.
They don't want them there, but
Yeah.
you'd be surprised, Counselor, who you see that's in recovery and trying to really better their life. I commend them, but they need support, and that's where another issue where it's lacked. And once again, it comes back to the senator and I and the federal government. It's money.
Yeah.
The bottom line, they need the funding to do this.
And
that's
you
what-
also need the community. You need the community to accept them back when they come back from their treatment and they're trying to live right. We have to embrace that. We have to respect them and not think of them as a drug addict. Oh, you're never gonna change. They change. I've met some amazing people in recovery. In the stories they tell from their past, you wouldn't be able to know that.
I know quite a few people that have changed.
But we have
and
to
they're great
embrace them
parents.
as a community and welcome them back. Because there are a lot of them that grew up here, and unfortunately, they took the wrong path, but they're trying.
Absolutely. This is all good conversation, and I think that what we had the representative and the senator here for was the funding sources. So if we could, is there any other questions before Councilman Capone? And then
Thank you, Mr.
Councilman
Chairman.
McLaughlin, you had one?
Through you to the senator and the representative, thank you very much for being here, and thank you for all of your efforts at the State House for everybody. We know just how horrible this is, and speaking to Patty's point, how much strength and character it takes to come back and to be able to pull through. So rather than pushing these people away, we should be embracing them, learning from them. But with regard to the funding, the 75,000, and I don't know if you know this or not, but the 75,000 that was earmarked for schools, was that early education? Was that specifically what that was for, or was that a mix of things?
That was part of it, but it was going to the school department, and they were gonna use it at their discretion, but it was for that purpose.
Okay. And with regards to the earmarks, did the governor just cut all earmarks across the board, or did he pick and choose? Or?
Yeah, no, he cut all earmarks across the board.
Okay, because a little concerned about that, as you alluded to, because I know that at least publicly, you know, he and the administration talked about clearly
His
being
state-
aware of the
State
crisis.
of the Commonwealth Address.
So I'm hopeful that your efforts, and thank you for following up with your bills, and I'm hopeful that the administration, the governing administration, will look at this and find a way to help fund it, because I think we all realize, as Councilor Flores says, this is worldwide. I mean, we had presidential candidates talking about this way back when we had, 10 deep in each party. So we're all clearly aware of this crisis, and we all have to do our part. So, yeah, I appreciate your efforts. I appreciate everyone's efforts, and thank you.
And so there are three ways we can get funding between now and the end of the year. So if we reinstate the 9C cuts, then we get that money right away. The legislation that we filed, we can work through that process and hopefully get something passed very quickly. Or the budget. So our own budget's coming out, so we can put these back into the budget. The budget is signed for the end of June. July 1st, we can fight to get these earmarks, because we'll put them back in, and we'll get them. Because these are one of our top priorities, so we'll make sure we get these earmarks back in our budget for the next fiscal year, but we need your help too.
Sure.
So where you can help is, and we don't ask this too often because we never really need the help, but it would be great to have the counselors, MMA, the Mayor's Association, Superintendent's Association, School Committee Association, say these earmarks should be protected. We should make sure this is a priority in our budget. And it'd be very helpful to have the local officials validating what we're talking about at the state level, saying we need these funds for our local communities.
Sure.
And that would be, very helpful for us to do that, so.
We're gonna
We'll
make
get
a
them in the
motion,
budget,
Senator,
and
on
we'll work that, but hopefully we get them back before the budget process
Yes.
starts.
So we're looking at something possibly in June, maybe, if in fact we,
We're hoping sooner.
Yeah.
Mr.
Yeah,
Chairman.
okay,
Yeah.
all
We're
right.
hoping the end of February.
Okay.
It'd be nice to get it next couple of months.
Yeah.
We'll know next couple of months for sure.
All right.
Because we
So
won't wait till
you'll-
the end of the fiscal year. We're gonna have to get this done next couple of months, so it
ASAP,
doesn't
yeah.
happen.
I just have a request that you report back to us with that when it comes out, and if the funding's there or not, or a portion of the funding, so that we can
That's
look
a
for.
possibility too,
Yeah.
exactly.
Right.
And then we could go after another portion of the funding here, as we're doing as well, just so we can get this piece of the puzzle in there. That's a big piece right there, and that's what we need. So when you're discussing that with Mr. Obremski tomorrow,
Yep.
he'll probably say, I talked to Leo McKinnon
Chairman.
all the time, and he'll say that,
Yeah.
and we're looking for this, we were looking for that money to
Yeah,
come
it's
through,
all
so.
of us. It's all
No,
of us
I know,
trying to
I
do
know.
it, Mr. Chairman.
Not to belay the subject, did you have anything, Counselor? Okay.
I do.
Ms.
Please.
Scalise, please state your
Oh,
name
boy.
for the record
All
as
right,
well.
I gotta go now, Mr. Chairman.
I'm trying to,
When you talk to Obremski tomorrow, I know funding's a huge part of it, but there's also a whole lot of organizations out there that go to schools and speak for nothing.
Yeah.
And I know quite a few, so maybe that's a different way. As long as we're talking about it, we're opening up communication. And it's not a one-time talk. It has to be ongoing with these kids. It can't just be go in and say, don't do drugs. It doesn't work, clearly. It's gotta be ongoing, but there is, if he could let these organizations in the school, and I've brought it up a few times, but we just can't get them in the school, he won't let them in.
We'll-
And we
we'll
need them
work
in
on
there.
it. We'll work on it. And they come to the State House, those
No first time,
programs and
Evan
everything?
Green's
Yeah.
Yeah.
parents were there last night.
Yeah.
Yeah.
And that's a great program. And a lot of people in recovery go and speak to these kids, and it's free. You don't have to pay for it, you just have to get the kids in an auditorium.
Okay.
And there's movies out there that you can
We
show.
just had an email today on a movie about sports.
Yes.
So, and I'll send you that link on that. So,
Yeah.
Councilman McLaughlin, did you have something?
I was just gonna ask Ms. Scalise if there is any currently in our system, but you've answered that there is none currently in our school system that's doing this.
No, we tried to get that, we
Informational.
were gonna have our week of awareness at the high school before prom, making good decisions. And, no, we got the crashed up car in the yard, which became a prop for selfies for the high school kids.
Yeah, that only goes so far.
You
We'll
need
have
to
to-
talk to them.
We'll have
you
to work
just-
on it from
yeah.
this committee.
I
well.
agree with you that we need to do some work from this committee.
Absolutely.
In conjunction with our state partners to see that in fruition in the very near future.
Thank you. Before I let you go, there was a state meeting that we had last year. And at that meeting was all state officials that had hiring responsibilities and employee responsibilities. And the topic was opioid use on the job. They had no clue of what they were doing. None. Me and Mr. Hanlon, the president at the time, we went to that. We attended it. They were more interested in how to go about getting rid of people that had,
Help them.
instead of helping them. And what I did at the end of that, I got up, and there was probably, I'd have to say, over maybe 1,000 people there. And I got up and I said, basically, ladies and gentlemen, although you are, the employer, you never know when it can touch your family or your family. It's a disease. It's not something that these people want to do. And you should look at it like that.
Yeah.
And you should look at trying to help before you try to hurt. Some of these people just can't, one day, I'm going to be off, I'm all set, and go
And
back
that's
to work.
education, Mr. Chairman.
Oh, it
That's
is.
education with all employees, even myself, Mr. Chairman.
Absolutely.
I never recognized the signs of it when I had employees working for me. I had no clue. I did not. People sleeping on the job,
Sure.
this and that. I did not know. So once again, it's education for
it-
even at the state level. So.
It's huge. And I was kind of taken back by what was being said there, and then I had to get up and say something, so I did, and me and Mr. Hamlin left shortly thereafter, but
Good.
after we spoke, and after I told him, I said, it's all about allowing someone that was sick to come back to work, to actually have a job, to have funds back into their family, that those funds were not there prior because they were being utilized for the sickness, is a big thing. And on top of that, we said a couple of different other variations of that, and they should actually look at doing something that can help these people to get jobs, because that's another problem with it. You're a father, you're a mother, you're trying to support a family, you're a single parent. Guess what? No job for you because you're an addict. It's wrong. So they need to look at all aspects of this, and that's the message we're trying to send to you to bring to the State House. I want to thank you both for being here. We have other guests that are here.
Thank you, Mr.
Excuse
Chairman.
customary thanks. Thank you.
Thank you.
And if we could just have a report back when and what action's going to be taken?
Yes.
That would be awesome. Thank you very much. No, you stay there, Ms. Scalise. You got the hot seat now. I'd like to bring in Bishop Brown and Father Jerry. And I'm assuming Reverend Coots had left? Oh, he did. Okay, thank you. He had an emergency, but he was here, and it took a little bit longer than we expected. I'm very sorry for that, gentlemen. Thank you for appearing tonight. If you could both state your names and positions. Patty, give Bishop Brown the mic and just turn it on for him. Once it's green, it's on. You're good. Father Jerry, that's all set, should be ready to go. If you could just introduce yourselves, names and titles, please.
Yeah, Father Gerald Osterman, pastor at Immaculate Conception.
Thank you,
in
sir.
Everett.
Bishop Robert G. Brown, pastor, senior pastor of Zion Church Ministries.
Thank you. Thank you for appearing tonight. The reason why I've called you before us is I was trying to get a concept of what programs, if any, and if there's discussion during masses or anything on this topic. As you can see by the people that are here tonight, it is a problem within our city. And I just wanted to get insight from you two gentlemen tonight, as well as Reverend Coots. He had to leave for an emergency.
Well, primarily and unfortunately, the thing we do most is bury victims. And it always touches like a sting when that happens. Not only teenagers, but people that are 30 and 40, but still, from my point of view anyway, young people. In terms of programs at the church, well, we offer space for 2 AA programs. I would say we don't do enough, but we're open to doing whatever we can in faith formation classes for primarily the high school, although I agree that the lower level is probably key. We've had speakers on addiction, and but it hasn't been regular, and it needs to be, obviously. I have spoken at on Sundays about it, but I think somehow all of the information that has been spoken about here needs to become more public, because I think people need to see the issue as our problem, not a few unfortunate individuals. And in a congregation that would tend to be on the older side, beyond the childbearing age, they don't see that as their problem, and yet it is. And So, say some of the statistics, which I don't have, for Everett itself would, I think, open eyes and be happy to
Father,
do that.
right now, this is live, being taped live, and it's going out to the whole city. So whatever you're saying now,
It's all right.
they're
I don't-
being,
I
they're
don't
being
retract
heard.
anything.
It's being heard. So there's probably, we'll roughly say 60,000. So, so speak freely
Mhm.
on this matter.
I think we all need to continue our education. I would agree that early childhood is very important, but I wonder if pregnant mothers aren't where we should be focusing attention. It seems to me a long time ago, we made those efforts with regard to smoking and alcohol when you were pregnant. And maybe we have to get back to that. And
Revisit.
help mothers.
Sure.
Before youngsters get to school.
Thank you. Bishop Brown.
Sometimes programming doesn't take place until it's found to be necessary. Obviously, the situation is one that's on the front pages, a lot of places. As far as the church is concerned, during messages, sermons, there's always some reference somewhere because it's a societal thing. It's how we live today. It's epidemic portions where we are spending time tonight talking about it. I do have some issues when it comes to how we look at dealing with this. You heard the word education utilized an awful lot tonight. And it's not just education at early ages. Those early ages wouldn't know anything about it if it were not for our parents sometimes, or their parents. It's total education, from the top down to the child. It has to take place at some period point in time in life. We have an awful lot of latchkey children today, single parent children. There are a lot of issues that we have not thoroughly taken time to fully investigate as to what approaches we need to take in order to help, if possible, to alleviate the problem. The other thing that weighs heavy on my mind is this is not a new problem. It only looks like a new problem or a more concerned problem because the problem has really become a problem. It has existed, and yet whether it's the city, the state, or even the church in some instances has acted as if drug addiction somehow bypasses it, but that's not true. There are persons who have been quietly addicted on different drugs in all of our churches, and unfortunately we have not done as good a job dealing with the issue as a lot of churches are beginning to do now. And when I say that, basically inner city churches, because at one time it was believed that this was an inner city problem. Well, we're beginning to find out it's in the burbs as well, and really big in the burbs, and so nobody's escaping. One of the things that I just came out of a staff meeting on this last week. We have to do more through the education process by doing seminars, having qualified individuals come in to talk about this epidemic. But it's not only this; it's also on mental health as well. Health issues. How do you handle certain things? How do you see certain things? You just can't throw folk away. And so we really have to find ways to be effective in what we do to bring about change. And so it is my belief that the church and the community at large need to find a way to work together to build a bridge because, as I constantly say, the people that you have, or the people that I have. And so some of the information that I've heard tonight, some of it does not even filter into our churches. And that's one of the things that we need to do as you're passing out pamphlets and things of that nature. Somebody needs to hit a directory and make sure that the local parish is receiving the information as to where they can go
Sure.
to receive assistance in issues that are now popping up daily within the church. There are a lot of things. I also heard somebody talk about programs that are running some effectively and not so. Part of that is because of the revenue that we may not be putting into these programs in order for it to run well. But you can keep pouring money in there as well also, and it's still not run well if it's not monitored correctly. And it's difficult for the Commonwealth to really have the manpower to monitor a lot of these programs. And so this issue is much, much bigger and much greater than the person who is addicted. It's how we actually go about helping them to overcome something that, if long-lasting, will take them out of this world. And so what we have planned to do and are planning to do is to really pick up our responsibility in educating from the top down, in between, and the bottom, touching not only the children, but touching those adults who have those children in their hands a lot longer than I do.
That's exactly that's exactly right. I mean, you sort of need to get to the head to get to the children.
Yeah.
And if you can do both at the same time, we may be able to save a generation. So that's what we're trying to do. That's why everybody's here tonight. Do you have something, Councilman Capone? I'll open it up to the
Thank you,
floor.
Mr. Chairman. Through you to our guests. First of all, thank you for your patience. Thank you for all the spiritual guidance that you provide for the community. I know both of you work very hard in your vocation. The closed sign never comes on. So, we do appreciate that. It was good to hear from you firsthand because it's been addressed. It is a community thing. Everyone has to be involved. Congregations, private citizens, government, everyone, employers. Everyone should be involved to try to resolve it. And both of you had mentioned the need to get additional information, pamphlets, numbers, statistics, anything that we can do to help you spread the word and get the education out there. So I do appreciate that, and I'll do whatever I can, I know the committee will, collectively, to get whatever we can for information to both of you so that you can share it with congregations and hopefully help educate everyone and help get a handle on this. So I do thank you for coming, and I appreciate that insight. So,
No problem.
Thank you.
Councilman McLaughlin.
That was one of my questions, Mr. Chairman, was did we have any more material from, I know last year we passed out thousands and thousands.
45,000.
45,000 across the city. If we had any more material left from what
Yes.
we had obtained from the state.
There's also a free grant, state grant. There's numbers, there's pamphlets that we're going to be giving you now. And those are just some of the pamphlets that we have, but we have more that we could furnish to you, probably boxes, because I've been giving them out to schools and
So we do
everywhere
still
else.
have material,
Yes,
material
we
from
have.
last year.
We have minimal material, which I'm ordering more,
I have
and I will
some.
get them.
You do as well, Patty?
Okay.
Okay, great. So we
Did you
have
get it from me, or did you order it?
a whole
Did you
lot
order
of
it?
avenues.
Exactly.
That's great. So we have avenues to get
Yeah.
into their hands.
Can I
A
just-
question,
oh.
excuse me.
I was just gonna say, you're right, and you're also right, it's not just up to the teachers, it's up to parents. Us parents have to start talking to our children. We have to open up that communication. So I don't want us to feel like it's all up to the school department, it's all up to the city. It's up to us as parents, and adults too,
It takes a community
yes.
to cure this, not one or two people.
Yeah.
So,
Because I'm guilty of that. I didn't know about oxys, and I didn't know about heroin, and I just told my son, don't do drugs. don't do this, don't do that, you know what I mean? It wasn't something that I knew about, or how deadly this disease can be. So we need to educate the parents too, teach them, guide them to talk to their kids.
As a community,
Jerry.
are we sending a mixed message when, on the one hand, we're doing everything possible to deal with this epidemic, and yet marijuana is going to be available to young people who medical people tell us their brains aren't developed till they're 25, and if anyone sees contradictions or hypocrisy, it's young people.
Absolutely. That, I think that right there, that's gonna hinder efforts, what we're trying to do. And I can see it as a problem. Medical professionals that had actually come and testified here, they deadly against it. They're saying that that is probably one of the gateways to get to what we're talking about now. So it's a problem. It's going to be a hurdle. But we've jumped over hurdles before, and I think if we're strong enough, we can probably jump over that hurdle as well. As long as the education's there for them to make the right decisions, and they're hearing it on all levels. Not only, we've had testimony here where they've been hearing it on the baseball fields, the football fields, the playgrounds, pamphlets, through TISA, through the high school, through CHA, through many, many, many different, variations. It's coming at them now. No stigma. We stopped the stigma. ECTV, we put on a multitude of stuff on ECTV. It's even been CHA put something in the papers about it. So we're trying to stop the stigma, and we're trying to get people to talk about it. But if we can hit them on all levels, I think that's what we're trying to do, and that actually hit them at church, at your place of worship, at the playground, at school, here. It's being televised everywhere. Maybe they'll get it, and maybe we have a hope of actually saving the next generation, because right now, the Narcan that we use is the last stage. So, and it's bringing back life, and it's very valuable. I agree with using it. We need to use it. We need to have it, and it's a great thing. I'm going to give you just some stats that we've had from here, from previous guests that were on, basically, and testified here. 87% of the opioids made in the world is utilized in the United States, which is 4% of the world's population. So we all know someone that's probably addicted or struggling or banged up or whatever you want to call it. But we know someone. 8 out of 10 children end up in a NIC unit at $200,000 per child, per month. That's huge. So it's not something that's going away anytime soon. But I think if we can actually educate more, start off early on, we may be able to save the next generation, some of them. But it's going to be continuous. This is something that's not going to go away. And you're going to see it probably for a couple more generations anyway. But anything?
Mr. Chairman,
Yes, Mr.
if at all possible, I think it would be helpful because of the graveness of the situation, recognizing that this issue is about people, regardless where they come
humanity.
from or where they go.
Absolutely.
If we could develop a relationship with the religious community in particular, so that pamphlets like this can be, as they come out from whatever organization that folk can benefit from, develop a source of an avenue of resources that we can, as we are confronted with this issue, who do you turn to? Where do you go? There are some things that I cannot
Yeah.
handle directly in my church, but if I'm working with somebody, I have a telephone number somewhere where I can turn to. You see, sometimes the faith community is the last community to receive some of this information because they're left out of a lot of the conversations that are going on in City Hall or the State House or whatever. So to have this type of information, having this a year ago, could have passed this out a year ago. I could have developed some dialogue on this to help heighten the awareness so that
Sure.
if someone were in trouble, you know, we'd know how to handle it a little better.
Right now, and great question. That's a great question. Right now, what we were trying to do is we are trying to get the mechanism in place, and that's the testimony you heard early on from the mayor's office, Human Resources, Catherine Rollins, the chief, fire chief, and the captain. Those resources that are in play now are going to be the clinician, program coordinator, and recovery coaches. You also have organizations, CHA, Everett Overcoming Addiction, that are out there now. We can furnish you with a list and the names of those
That would be helpful.
that when you do notice someone going astray, you can pull them back in and point them in the right direction. That's a great question. We were trying to get the mechanisms to go forward and play first, but it took time because of the money situations and the restraints that we had, which were actually, we applied for it, we applied the committee to it. We said, basically, we were gonna do the no stigma, and then we were gonna go into the clinician, the program coordinator, the recovery coaching. Now, we're looking at putting the recovery coaches into the fire stations all over the city. So there's going to be resources that are going to be available. We wanted to get those resources available first before we actually started getting out there. So I know one thing, Ms. Scalise, she does a vigil. It's been, what, how many, 190?
Yeah, oh, yeah.
About 190 deaths that they recognize at this vigil, and they'd like to see all or one of you to come in and do the prayer for it. So I know that she had mentioned it to me, so I'll just give it that now. But
I'd like to hold a mass too.
and
Hope
yeah,
and recovery mass. Reach out to the recovery community or those struggling. Let them know they're welcomed.
so Councilman McLaughlin.
Thank you, Mr. Chair. Through you to Ms. Scalise. Ms. Scalise, I know that we had talked when we started to do the recovery coaches that we wanted you to be involved in that selection process and that we wanted you to be hands-on in that process through all of those positions, being really the foundation in this community of this epidemic. Have you been involved in that process? Have you been had any say or input in any of this that we've?
No, because it's just at the ground floor right now. I need to produce a list and get the recovery coaches in place.
Okay, so we don't have the candidates yet in place for the recovery coaches. Is
Well,
it?
we have a few, yeah, that
Okay.
want to do it, yeah.
Counselor, on that, I think what they wanted to do is have, when the program coordinator and the clinician come on board too, they want to be part of that as well, so
Okay,
it would
yeah,
only
so
be
I-
proper to do
So
that.
I'm sorry, I missed that step. So we're waiting for those two positions
Yeah,
to be
we're pretty
filled.
much waiting for that,
And then we're gonna go
hopefully-
forward with the recovery coaches.
Hopefully, it's in place, because it's gonna be a year. I have to get that off my chest.
What?
That
The-
program coordinator job came out last year in March. It is now February. That's too long.
And I think we have.
It's too long, and I don't wanna sound bitter, but it's too long. We have to step it up.
And I definitely think that we all agreed a few months back that It was too long, and that we were going to take more of an aggressive approach to both of those positions. And I think that we have, but you're 100% right. A year to fill a position like this has caused us a lot of heartache in the city, and there's no question of that. So I apologize that I missed that step, that we're waiting for
That's
those two
okay.
positions to be filled, and then we're going to go forward with the recovery coaches, because that was my follow-up, was have we gone anybody into the program, but that's what we're waiting for.
You mean, you had 4 overdoses last week,
Absolutely.
2 fatalities, and 2 were revived with Narcan, my son being one of them. So that's 4 in a week.
We actually had 3, right, 3 fatalities.
Oh, then 3, and then my son made it, thank God, you
Thank
know.
God, it's right.
And then I call the opiate hotline at City Hall, and it's a recording with some man saying, "This is the Everett opiate hotline, I don't know what I'm supposed to say, beep." I called here, I was angry, and I'm angry now. Like,
Yeah, I'm
yes,
actually-
that's what it said, and they finally shut it down. But
I'm
that's what I'm
actually
saying, we
shocked
have
to hear
to,
that.
we have to pay attention.
Don't be shocked,
We
I
have
called
to-
it myself. I called it myself,
Yeah,
Counselor.
we just need to step it up,
With-
and
with
we
that-
need to stop
yeah.
talking and start doing.
With that being said, we both called it and found out that it was that. So now it's shut down. Is your number on that?
It shut down, that number goes right to Everett City Hall, and they give out the State Without Stigma phone number until those 2 people are in place.
Okay.
And
That'll be
everybody
probably
always makes
Tuesday.
that comment,
Yeah.
"Oh, well, if we had them, do you really think those people wouldn't have died?" Well, who are we to decide that?
You don't know?
Why not?
No, you don't
know, it could save one life. and-
So, with that being said, I think they got the hint, and you were loud and clear, I'm sure of that.
Yeah,
And,
sorry.
And now, moving on. So hopefully that will be rectified once the 2 come on board.
I hope so.
And then the 10, which we're gonna need a list, and we're gonna have to do screening on them, so.
Mm-hmm.
And then they're gonna be candidates to, the recovery coaches, we put the funding for, Counsel, if you don't mind me to explain it. We put the $6,000 for 10 recovery coaches. They're gonna be certified in recovery. So, Bishop or Father, you may wanna actually see, maybe to set up a time for one of them to come in and maybe actually talk, maybe on a Sunday or whatever day you want them to come in, to a group of people. The clinician and also the program coordinator will be actively out there in the field as well, so you'll be seeing them. So all you gotta do is request them to come in and talk to whoever you want them to talk to as well. But we were gonna put them out in the fire stations because we're figuring that's where they do it in other cities, and that's like a safe, they call it a safe house, so that they could just waltz in to the fire station, tell them that they have a problem or an issue going on, and then they can actually get help from the recovery coach that's there, and it goes right up the line, so that everybody's involved with that.
Will we have a way to identify who they are?
Would you have a way to identify
Who they are?
the recovery
If we
coaches?
want it, right.
Yes, yes. We're actually putting the 10 recovery coaches together, that's what they're talking about now.
Okay.
Will they
So-
be bilingual?
You'll probably have a variation of languages.
Yeah, good.
So that's what we need to do and sit down with the clinician and also the program coordinator to get that done. Because I know right now in the city, there's what, probably 62 different dialects of language. So we're gonna need that. And if not, we may need an interpreter to go along with them. So if that's gonna be a problem, I don't foresee that being a problem because we have so many people that are kind of responding to it. So we'll see what happens from there. If you have anyone that you think that may be, perfect for that position, please get it to us, and then we'll get them on board as quick as we can and certified. I know that they do it out in Worcester. They do the certifications in Worcester. Where else do they do the certifications?
I'm thinking CHA is, no, you're not doing it anymore.
Can you come up, please, from CHA, and just state your name and title? You can come right in one of these chairs right here. I should have had you up here earlier, but I'm sorry.
my name is Jamie Lederer. I'm the coordinator for the Substance Abuse Coalition, which is an initiative of the Cambridge Health Alliance.
Thank you.
And I don't know all the details of the recovery coaching certification. I know that there's been some shifts and changes through the state to make sure that it is sound certification, that people are getting the right support as recovery coaches, and that there's appropriate supervision for them, because it is a challenging position, especially if you have lived experience and you're
Sure.
working with other people. So there is a consistent state training that's done at least yearly, and I know that there's been some shifts and changes that have been really positive out of the state of Rhode Island, and that the state is looking at that.
Okay. Now, do you offer anything currently? Do you guys offer anything currently?
Offer in,
Certification?
no, not that I know of. I'm not in that area of Cambridge Health Alliance. It's something that I can
Now, I know
investigate
Jean
better.
Grenick had sent me, and she's another Cambridge Healthcare Alliance. These are people that I deal with on a daily kind of. She sent me something today, and it wasn't printed out for me tonight, but do you know anything about?
Are you talking about the sheets about school athletics and
There was a couple of,
opioids?
yeah.
Yep. So that.
Can you touch on that?
Yeah, so.
Thank you.
Well, thank you for inviting me up here. And I'd also like to just speak a little bit about the program coordinator position.
Sure.
I can speak about that after. So the state has identified athletics as a priority area in terms of more education because of injury and understanding a little bit more about kind of the pathway to addiction through pain medication related to an injury. And so through a number of different initiatives has worked really hard to create resources for schools. And that's not the first time we've shared that with the school system, but it, we always think it's good to remind people, and so it's available through MassTap, which is an agency that's contracted through the state to provide evidence-based sound research and information for communities.
Sure.
So.
So those were there was like 4 different items that you
Right.
wanted to touch on.
Yeah, and
Okay.
so the hope would be that we'd be able to provide this kind of information education to parents at athletic parent nights. There's a lot of time spent on concussion, not as much time spent on other issues, and concussion is very valid and important as well. But it's been a challenge to get some of that information to athletic departments. I'm not stating that specifically in Everett, but just in general. And
Throughout
so
the
that's been an
state?
identified area.
Statewide? Okay.
Yeah. Yeah, and there's a video that Dr. Poti speaks on, and if anyone's ever seen her speak, she's a fantastic speaker. The video is a little dry, which was surprising. Just that's why she was asked to speak to communities for it, but very well educated, informed, and understands the issue around brain development, substance use, and impact.
Okay.
And I
Anything
just
else?
wanted to speak about the PFS program coordinator position as that funding came to Everett specifically. It wasn't actually a grant, but understanding the rates of overdose and death for opioids. I share your frustration that the position hasn't been filled, absolutely, and have been working hard to implement some of the pieces that are related to the position. And in our role, Jean Granick and myself will work closely with the hired person. That position is actually in the you guys have used the term early education. We use the word prevention, but it's really, I wrote a lot of the strategic plan related to that role for Everett, and it is a lot of early education implementation, not just in the schools, but in the community. And so some of the work is around understanding safe use and prevention of use that's targeting towards high school age youth, and then also working closer with pharmacies and working with parents to understand prescription monitoring and safe storage and disposal as well. So there's a number of different pieces around it. So so the pieces that we talked about at the beginning of the night around early education, intervention, and outreach, there'll be some school-based as well as community-based education efforts.
You're also in the TISA program, correct?
Yes.
Okay, so you want to speak a little bit about that as well?
what TISA is?
Yep.
Sure. So TISA is a community-based youth program that started 11, 12 years ago, I believe. I didn't start it, but I've been running it for 3 years, and it's open to any teens in Everett. They don't have to be Everett High School students. We've had students from a number of different schools participate, and they learn about substance use. They learn about, it's kind of a skill-based piece, and it's leadership development. And so under different programs, they've been able to do a lot of advocacy around policy that would impact youth. So a lot of the tobacco regulations and changes that have happened over the years around youth access, they've been involved with, such as banning the sale of tobacco at pharmacies in Everett. That was really we were one of the first communities that offered that. That became a huge initiative from CVS, and now Walgreens is looking at it as well. And so that started out of youth understanding prevention. And so I appreciated the comment earlier that Ms. Rollins made about over the 40 years we've really seen changes in tobacco and prevention. And we can do that as well with prescription medications and opioids as well. So TISA focuses, they identify the main issues. Alcohol and marijuana really we see still as the substances of choice among teens in Everett, but they're not exclusive to those topics. And this is actually a National Alcohol and Drug Facts Week, and they created announcements that have been every day in the schools around a number of different substances, which is also, they've been repeated on our Facebook page. So alcohol, marijuana, the social host law that parents could get in trouble for providing alcohol for their kids, or a party at their house even if they're not there, making sure young people are understanding decisions and choices and not just knowledge about the substances but skills. And so TISA is written into the Attorney General grant that we're still waiting to hear about.
Yeah, that's
and
right.
doing some prevention work at the middle schools and doing some peer mentoring and education about that.
Was that for curriculum based? I know that I was part of it because I was going to mention it, but bring it up.
Yeah, so I recently read an article that the applications totaled $3.6 million for the AG grant, and they had $500,000 available. Through a settlement with Walgreens, another $200,000 has been added to it. So we're still waiting to hear. We put in a very robust application. We'll hope to get a portion of that. But it is around more focused curriculum at the middle school level, and as well as this peer mentoring piece as well.
See, that's why the funding for the teacher to come in, and this is critical with that, those that go hand in hand.
This is the $75,000
Yes.
for the prevention specialist. Yeah, that was extremely disappointing. The schools have taken a huge hit, but still have managed, in terms of various funding issues, but still have managed to provide comprehensive health education K to 12 in
Sure.
Everett, which is unique. It may feel like not enough, but it is unique that it's in Everett compared to some other communities that perhaps have more money. That we do have good health. I do believe we have really good health education in our schools, and there's more that we can do to supplement it.
The
as well.
woman that put the grant together was from the school department. Very great lady. I don't want to mention her name now because I might have her come up as a guest one night, but.
Yeah, and we work closely with her.
Yeah, she's a good lady,
to work on
and
that.
she put a very good package together. Hopefully we do get that, and hopefully it's for the amount that we put it in for, so that would be great. So I need, do you have a business card?
I do.
Okay, could you just give it to the clerk before you leave? Thank you. Is there any other questions?
Thank you.
Excuse the customary thanks. Thank you for appearing tonight. Thank you. And if there's any questions, please contact myself or any one of the committee members, and we can get you any of the information you request. We can get you phone numbers. We can get you, there's a daily bed list from Ms. Scalise from Everett Overcoming Addiction. Whatever resources you need to help you, we will give. So just let us know. Thank you for appearing
Thank you.
tonight. You can- Closing remarks, anybody?
Mr.
Hold on.
Chairman.
Is there anyone else in the audience that's here from an organization or another committee throughout the city? Anyone? Does anyone want to come up and actually address the committee? Please come up, state your name and title.
I'm Bob Mara. I work here for Cambridge Health Alliance. Been working here now for 11 years, know most of you. And I wasn't planning on speaking tonight, that's why I'm dressed like this,
That's
sorry.
fine, Bob.
My colleague does a good enough job without me. But I just want to mention a couple little things I'm doing, and maybe sometime come back and talk a little more detail. But I've been working for the last few years with people coming home from prison and jails that are referred by our doctors and with Chief Mazie and the Everett Police. And about 80% of those people, there's about 100 people coming back every year to Everett. It's the highest rate of people coming back of all the communities that Cambridge Health Alliance serves, about equal to Chelsea. But we serve 7 communities, and it's a pretty high rate of people coming back. And about 80% of those people have substance use problems.
Sure.
And I'm sort of the case manager in training, if you will. I'm trying to do what Patty Contenti does over in Somerville, and somewhat of a recovery coach without having been trained. Patty Contenti in Somerville does a 40-hour training of recovery coaches, and I may take it myself, but I'm told it's a really good program.
Is it certified training?
I think it might be. I don't know
Can you
for sure.
check that for us, Bob?
Yeah, I'll check that out. I'm pretty sure it is, but it's she does everything top notch. So,
Sure.
and I did that this morning with somebody coming out, and so I'm really glad that you all have committed to that funding of that clinician. I think that's huge. That is what they do in Somerville. She works straight out of the police department. She works with social work interns up in Billerica. They go up there first, and then when people come out, because people do the worst damage, as you're probably well aware, in the first weekend that they're out. And that's what we've learned. I work with a fellow came out straight out of solitary in Shirley to Revere, and within that weekend he was in the ICU at Mass General and was the only person, so I was told, that in that ICU that night for that reason that survived.
Yeah.
And it's a huge problem because the prisons, quite frankly, don't do what they should be doing either. Most of them. Some of them, Hamden and Springfield, do a great job of caring for people inside. But again, I'd like to talk more about it because that's what I'm passionate about. That's what I'm doing. I'm doing a full-time paid, a little bit to do it from Cambridge Health Alliance. I'd like to do it some more, and I think there should be more people doing it because the need is huge. Anyway, I'll just stop
Now,
there.
let me ask you a question now, since we're on the topic of the prisons and recidivism rates and everybody returning back. Sometimes they return back. Middlesex County, the Sheriff Peter Katujian, they testified here that they have a Vivitrol program. Did you know?
Yes.
Oh, yeah, and how are you seeing that working out with prisoners that come out of there?
Well,
the population that comes out.
Yeah.
I know they do a follow-up background with it and a background program with them, but I wanted to know what
Well,
you're
I know
seeing.
they've had a good program. I don't know that much detail. I know that
Okay.
there are some people, clinicians on our staff at CHA, I think over in Cambridge, that are working with them on it. But that's not my expertise, so I can't
Yeah,
comment.
I'm wondering if you've seen anybody that actually is in that program?
No, I haven't.
Okay.
No.
If you do, too, could we have that as well? Because I want to keep kind of a tab on that as well. Reason being is because he started a program, and I think it's the first in the United States, the Vivitrol. And Peter's a good guy. I like Peter a lot. But he focused in on that and then monitoring of Vivitrol. Vivitrol's a shot, and it's a blocker, an inhibitor, so they can't get high anymore. And what they do is they do it once a month. It's right into the muscle, and then it's a solution, and then it stays with them for a month. They get it every month, but there has to be monitoring with it. So, and they monitor it from the prison, from what I'm gathering. So, from the testimony that we had prior year. So I just wanted to see how effective it was going. And-
Well, you heard from, I mean, they're doing, for what we hear, Middlesex is doing a lot, more and
Oh,
more.
the-
And that's who, as I said, I've been up there with Patty to Billerica, met with the Director of Social Services, met with the fellow who's the commissioner or whatever, Bill Reck. He lives in Charlestown, very
Sure.
supportive people, Jenkins.
Yeah.
So, yeah, it's a really good crowd, doing more and more, and again, they're doing it when people are inside, before they come out, and then, again, trying to have a direct connection when they come out. That's the new job about to start in a week over in Somerville, where they go up there, they connect inside, and as soon as they come out, they're the case manager for the person coming out, and
Sure.
right away. So.
Now, do you do support for the
Pardon me?
individuals? Do you do any type of support mechanism for them coming out?
No, I was gonna be doing some of that with couple with Patty
Okay.
and some of those Somerville people. I'm hoping that somehow in Everett, we can, do something similar at some point. That's what I'd like, at some point, talk more
Sure.
about.
I mean, we're looking at surrounding cities and towns. I've been working with several out of the committee, and what they're planning, they want to try to do is they want to try to utilize forces together, signing, like, if they need a recovery coach, they ask us. If we can give it, we do. If we need one, they give it to us, just so that we have manning situations already going. And they can live off of what they're learning in each prospective city as well. So that's what we were trying to do. We had Paul Hemsley here from Malden, and it's Malden Overcoming Addiction, but he now works for the city of Malden. They are putting, I believe they have 15 recovery coaches. So between Malden and Everett, you'll have 25. If we go over to Somerville, then we'll have many more. If we go to Cambridge and so forth, and we just, look at that. But that's something for a later date that we're looking at trying to do. So the more, the merrier.
Yeah, no, that'd be very helpful.
Oh,
I
yeah.
mean, as you know, there's the precedent of the Cambridge, Somerville, Everett police working closely together basically for the last 5 years
Revere.
on this, so,
Revere as well,
Yeah.
Malden.
yeah.
We're all in it together, so we should all be able to utilize each other at that point to help one cause. So, anything additional, Bob, that you have? Okay.
Okay.
Thank you for appearing tonight. Excuse the customary thanks. Any other questions? Any other closing comments? Councilman Capone.
I know that the senator had stated earlier some sort of a sentiment from the body. Did you want to send out? Okay, came to the record. Okay. Okay, so hold off on that for now?
Yeah.
Okay.
Councilman McLaughlin?
I'm sorry, I didn't hear Councilor Capone's comment, but I may be piggybacking off of it. I'm looking to see if we can put a motion forward tonight to ask the administration to fund the matching grant that we had from last year.
That's what I think Councilman Capone was trying to get to.
Okay, I couldn't hear what he said, so that,
Because of the mechanism that's going forward from the senator and the rep, we should probably wait to see if it's a portion of funding that they're gonna come up with.
I'm actually talking about the $10,000 grant for the Narcan versus the.
Oh, yeah,
the-
okay.
the-
I was
the-
talking about something separate.
Yeah.
Make
I
that motion.
apologize. So I'm talking about the fact that we spent $10,000 last year on Narcan, and this year we only have a $6,000
You
grant.
wanna increase?
Yeah, I would like to ask that the administration comes before the city council as a whole with a transfer of appropriations for.
Why don't we have, Ms.
Sure, we can do it if you
Okay,
want, Mr. Chairman.
bring her up, invite her up.
Can we ask that Catherine Rollins from Mayor DiMaria's office come before us again this evening?
Then you don't have to send a formal request on as a motion. She's right there. We just do it that way.
Catherine, good evening again.
Good evening.
I'll be honest, you learn something new every time you sit in the seat. And I think that was one of the things that I'm most surprised about this evening is the fact that we are basically on the verge of running out of funding for our Narcan. Can we go back to the administration and talk with Mr. Demas, our CFO, of committing X amount of dollars to a Narcan
Absolutely.
line item? And I think that the appropriate would be of $6,000 at this point to get us through the rest of the fiscal year, hoping that we don't need to use it all, but that we have funded in place so that the day never comes that we have to make an emergency decision to spend funding for Narcan. So I'm going to ask that we see that in the next council meeting, that we have a $6,000 appropriation for Narcan improvement of funding.
I will convey that to our CFO.
Thank you, Mr. Chairman. We really don't know how much money we're ever gonna spend on this Narcan. I mean, you can't tell. It's not something that you can really budget for. Is it possible to have a revolving account so that even if they don't use the money, it always stays there? And then at the end, maybe if, I mean, I don't think there'd be, I hope it always stays there, that we never touch it. I wanna know if that's possible. Maybe if you could speak to the auditor.
I will speak to the auditor
Okay.
about that, yes.
Thank you.
You're welcome.
Any other questions on this? Do you feel we need a motion on this, or no? All right. So, Ms. Rollins, if we could just have a report back at the next meeting on these, are you making a motion? Next city council meeting? Correct. Do we have to have a motion on it if it goes to the council? Okay. All right. So at the next city council meeting, we'll have a report back from you and also Mr. Demas on if we could actually do something to this effect.
Yes, he'll be the one who will
Yeah, it's
have the
February
knowledge.
13th, so you have time.
Yes.
Okay. Anything else? Excuse the customary thanks. Thank you very much for appearing again. Anything else? Any closing comments? Anything? Councilman McLaughlin.
I do just want to thank that I seen in the audience tonight, and we should have acknowledged him, but former Mayor David Ragucci was here this evening, and to see that the former mayor is back in our chambers, concerned about this issue is a huge testament to the seriousness of this, because he has had a long career in our city, and he has seen this issue, I'm sure, unravel from his days back here in the chambers through his career. So I want to thank him for coming tonight, and I look forward to working with him in the near future on this issue, and I think he has a lot of information to share. So I want to thank him for being here this evening.
Thank you, Councilor.
Thank you, Mr.
Councilman
Chairman.
Capone.
And along those same lines, it's been a long evening for everyone. We had a room full of folks. Many have stayed the entire duration, and I know as a committee, we appreciate them being here and their input and their help.
Councilwoman Rosa DeFlorio. She just wanted to thank everyone for coming. I'll make that for you. I want to thank everybody for appearing tonight, testifying. This is the beginning of another year. Last year produced No Stigma, I think, a couple of different positions that should help these recovery coaches if we get them in play soon enough. And hopefully we can get the phone situation checked out for Ms. Scalise. And hopefully we can get the funding for early education as well. We're going to hold off on motions for that reason being as we don't have an accurate account of what's going to be coming in from that, and if they can get the whole thing, that would be more than perfect. We also have the Attorney General's grant, which CHA had actually spoke about. That's in full force now. We're just waiting to hear back from that. Once we hear back from it, there should be curriculum. So we'll have some curriculum. We just need that teacher to focus in on that curriculum. So, Councilman McLaughlin.
Mr. Chairman, I'm sorry. Last point that I wanted to make, and I forgot this, and we had spoken about this on Monday evening. Community Development actually has a grant that has some funding available for some programming, and they want to come before this committee and talk to us
Invite
about
them.
the grant that they have available for addiction
Sure.
education. So I would like to ask that we invite up maybe Tony Souza or Mazi Gillespie from Community Development to the next meeting to explain to us
Make a
how
motion.
their grant works.
Make
and how
that
we
motion.
can tap into it.
Okay.
I'll make a motion that next meeting, we'll invite up community development representatives to talk about the community block grant funding that's available to our city.
Motion made and seconded. So moved. You have done so, Councilman. Thank you. We're all set. Motion to adjourn? Motion to adjourn. All those in favor? All those opposed? The ayes have it. Thank you for appearing tonight.